Hello, folks. This is Dr. Chandra, and for those of you who don't know me, I am the founder of Preferred Medical Group, and I wanted to come to you today to say wish you a very happy new year from the Preferred Medical Group family to your family. We are extremely grateful that you are our patients and that you have put your trust in our providers. And I just wanted to give you a quick update of things going on at Preferred Medical Group. Needless to say, the number one news is COVID. COVID is coming back with a vengeance. We didn't see it for several weeks, and last week it's been a huge number of patients that we are seeing. And I'm bringing this to you with the aim of also letting you know that we are overwhelmed with phone calls and patients and parking and everything else that comes with the huge numbers of COVID. So please be patient with us. We have 3 full-time people that answer the phones, and we still get complaints that phones are not being answered. We're not ignoring you. Maybe by the time that you're calling is when we're assisting somebody else. And I'm going to tell you the trick of getting in touch with us the fastest. Text us, please. Use the same phone number, 334-664-0463. Text us, and you're much more likely to get an immediate response. The other thing is, if you could please try to remember to get your refills at the visit and your appointments at the visit and ask all your questions at the visit, that would cut out some number of phone calls that may not have been needed. Thirdly, if you can get logged onto the Hilo app, which allows you full access to your own chart. So you can look at your own labs, you can look at what the doctor said at his last visit, where your referral is going. You own that chart, and you can look at it at home at your own leisure. For those of you who have not been using Hilo, when you come into the office next, please ask any of our staff members, and we'll be happy to show you how to get signed on, and you'll really, really enjoy it. So there's also been some new recommendations on COVID from the CDC that I wanted to share with you, most importantly in terms of what is needed for quarantine. So currently, the recommendations are that if somebody tests positive for COVID, you're expected to isolate for 5 days and then wear a mask for another 5 days. If you come in contact with somebody who's positive for COVID, if you're fully vaccinated, you only have to wear a mask for 10 days. If you're not vaccinated, you come in contact with COVID, even if you're not symptomatic, you should isolate for 5 days, followed by masking for 5 days. The other piece of information is that a lot of people panic when they find out that he or she was exposed to COVID last night. And they call us, and they are just wanting to get in right this minute to get tested. Again, we have to wait for 5 days to get tested if the patient is asymptomatic. If you're symptomatic, we can test you as soon as you become symptomatic. The other thing is that the demand has been so high that we have run out of rapid COVID tests as of last Friday. Obviously, we put in a request for immediate refills, and I'm hoping we get some more tomorrow. But in the meantime, we don't have rapid COVID tests, and we are doing the PCR test, which is a send out with a turnaround time of 2 to 3 days. So please be patient with us. And know that each and every member of our staff honestly comes to work to try and make a difference in the lives of the patients that we serve. We have been in the midst of COVID for the last year and a half plus, and honestly, everybody in the healthcare industry is tired and worn out, and it's taken a toll on us. So if you can, please do remember to thank your nurse or your doctor or the front office specialist, and just a small word of acknowledgement or thank you from you goes a long way in helping us keep their morale up. We've had several staff members who've been sick with COVID, and that is the price we pay of coming to the work that we do. It's risks of the job. I had a nurse fall sick 2 days before Christmas, and she was a single mom and worried about, shopping for her kids and making it a good Christmas for them. So we're never, ever not wanting to serve our clients, but please be patient. If there is a problem that you feel you are stuck and nobody's listening to you or you don't have an answer, call our office manager, please. Her name is Tracy. Tracy is very, very reachable. Her email is tgary, that's Tgary, at preferredmedgroup.com. You can also call the office and ask for Tracy. You can text Tracy, and more than likely, Tracy will be able to find a solution for your problems. So don't get mad, call Tracy, ask her to help you. We will try our best. And also wanted to get you some other updates. Dr. Kurdi comes back from vacation tomorrow, and he's going to be super, super busy. So those of you who are trying to get an appointment with Dr. Kurdi, be patient. He's very, very booked because he's been gone for a few weeks. We also have a new PA who's joining tomorrow. Her name is Ms. Peterson, and she'll be in training for the first month that she's here with us, but I think she'll be a very fine provider. For pediatrics, we heard from several patients they wanted to get a female pediatrician, so we've hired a very nice young lady called Dr. Mona, and she'll be joining us in July of this year. And another new exciting thing is that we've started a new program for children with autism. It's called ABA. It's a highly specialized program. It stands for Applied Behavioral Analysis. So we are going to offer ABA services out of our Phoenix City office and a new location in Columbus. And that pretty much sums it. Other than that, please stay in touch with us on social media, where we tend to post a lot more updates. And again, Happy New Year and stay healthy. Thank you.